Hello, everyone. Good morning, good afternoon, good evening, wherever you might be. Thank you for joining us today. Today is October 10th, 2024. And again, this is a webinar titled North American Genetic Counseling Organizations, or NAGCO, DEIJ Collaboration. Next slide. We'd like to start by acknowledging that we live, work, and play on ceded and unceded Indigenous territories on the land that is now known as Canada and the United States of America. We acknowledge that this history of colonization has contributed to the systemic racism that exists in our healthcare systems and has contributed to the lack of equity for Indigenous peoples in medical genetics. We recognize these truths and actively work towards reconciliation. Next slide. So the learning objectives for today's webinar, first, to describe the composition and purpose of the North American Genetic Counseling Organization's Diversity, Equity, Inclusion, and Justice Collaboration. Also describe ways in which NAGCO organizations are introducing measures to improve support and inclusion within their respective organizations. Identify DEIJ endeavors that aim to address barriers to diversity and representation within the profession, and recognize opportunities to apply DEIJ-related resources and educational content offered by organizations within NAGCO. Next slide. So to start us off, the purpose of this webinar, again, is to introduce the wider genetic counseling community to the collaborative efforts of NAGCO, specifically within the realm of DEIJ work. Each organization is at a different stage in their journey to more fully integrate DEIJ into their respective areas of focus. We recognize that a substantial amount of DEIJ work has already been done by others in and around the GC community, and we want to begin by acknowledging the importance of said efforts to the profession as a whole. It's outside of the scope of this webinar to review all of these programs and projects, but we encourage all attendees to take the time to familiarize yourselves with this important work. Next slide, please. So just briefly, today we will focus on introducing NAGCO and reviewing the various DEIJ specific projects and programs that have been completed or are underway across the various genetic counseling organizations. There will also be dedicated time to Q&A towards the end of the webinar. Please submit any questions via the Q&A feature on Zoom. Try to refrain to submitting them via the chat, and we'll be sure to address them before the end of the webinar or afterwards in writing if we run out of time. Next slide. So again, the NAGCO stands for the North American Genetic Counseling Organizations. While the leadership from these organizations have a long history of collaborating, the US-based organization started meeting regularly in 2011, and the full group, including CAGC, started meeting more formally as a leadership group over the last 5 years. The goal of this collaboration was to help identify and tackle common issues across the profession, determine ways in which the organizations can support one another, share resources, and create more cohesion across the organizations. Earlier this year, in 2024, a DEIJ-specific collaboration began and is ongoing. Today's webinar is our first joint effort, and we hope it will help improve transparency regarding the work each organization has been doing within the DEIJ space. From a timeline perspective, just back one second. From a timeline perspective, the National Society of Genetic Counselors was incorporated in 1979 and was the first genetic counseling focused organization. The Canadian Association of Genetic Counselors was incorporated in 1990, the same year that NSGC launched the Journal of Genetic Counseling. The American Board of Genetic Counseling was established in 1993. Prior to that, US-based genetic counselors were certified by the American Board of Medical Genetics. The Association of Genetic Counselor Program Directors was formed in 1994. This organization is now known as the Genetic Counselor Educators Association as of 2023. The Accreditation Council for Genetic Counseling was incorporated in 2012. Prior to that, standards for training programs were developed by ABGC. And lastly, the Canadian Board of Genetic Counseling was established as an independent organization in 2019. Prior to that, Canadian genetic counselors were certified by the CAGC's certification board. And so with that background, we'd now like to give each organization a brief opportunity to further define its mission and scope as it pertains to the profession as a whole.
Thanks, Sally. I'm Sarah Klaus Candidae. I use she, her pronouns. I have short black hair with quite a bit of gray peeking through, which might not be appreciated on the Zoom camera. And I'm wearing a light gray sweater, like brown skin, and a blue lanyard. And I'm here today on behalf of the National Society of Genetic Counselors JEDI Stewardship Committee. I'm the current chair for 2024 of that committee, and also here today in the audience is our vice chair, Christy Smith. The mission of National Society of Genetic Counselors as a whole is here on the left, which is to advance the various roles of genetic counselors in healthcare by fostering education, research, and public policy to ensure the availability of quality genetic services. The JEDI Stewardship Committee falls within that mission, but our specific purpose is to monitor and evaluate the organizational JEDI efforts within NSGC and evaluate our organizational progress on our JEDI action plan. So our committee was established in 2021, which was the next iteration of the DEI advisory group that had been formed in 2020. And yeah, I'm happy to be here today. And with that, I'll pass it off to Diane.
Thank you. So I'm Diane Miles Reed. I use she, her pronouns. I have light brown hair, short light brown hair, and white skin. I'm wearing glasses and a dark green top. I am here today representing CAGC. I'm the current 2024 president for CAGC. So our vision is that genetic counselors are trusted leaders in genetic and genomic care. And our mission is to strengthen the genetic counseling profession in Canada by providing members with education, community, support, and leadership. So throughout 2020 and 2021, CAGC recognized the need to address issues of DEIJ within our organization, profession, and the community that we serve. In 2022, a DEIJ task force was created with the purpose of performing an environmental scan of current initiatives within the CAGC and also to determine where more targeted efforts are required. The task force has completed their work, and following their recommendation, a standing DEIJ committee is newly established in 2024. The standing DEIJ committee will continue to coordinate and advance DEIJ initiatives throughout the organization. Thank you.
Hi, everyone. My name is Enrique Lopez. My pronouns are he, him. I have, I guess, brown short hair. It looks black on the screen, but it's brown. I'm wearing a black short sleeve polo, and I'm representing the chair for the DEIJ committee of the American Board of Genetic Counseling, ABGC. Also on one of the panelists that are joining Josie Baker, pronouns they, them, and they're the vice chair for the DEIJ committee. The mission for ABGC is essentially to establish standards of competence for certified genetic counselors and to advance their value as leaders in precision health to safeguard and serve the public. And our core purpose is to promote high standards in genetic counseling. The DEIJ committee was established in 2022. Originally, there was an outside consultant used to measure the progress of DEIJ efforts in ABGC from nonprofit HR. They assessed the certification process, things that could be better served for the diplomates. And the committee was essentially started then in 2022. Thank you. Next slide.
Hi, my name is Guyan Chan-Smutko. I use she, her pronouns. And I am an Asian woman with short black hair with purple streaks and teal glasses, wearing a black and orange dress, and I have light brown skin. I'm representing the Genetic Counselors Educators Association, or GCEA, and our DEIJ committee is chaired by myself as well as Layla Jamal. The GCEA's mission is to build a diverse community of graduate level educators to define best practices, facilitate resource sharing, and foster collaborations to promote equitable, inclusive, and just education for genetic counselors. Within that, the DEIJ Standing Committee was established in 2022, and our committee's goals for the 2024-2025 academic year focus on training the trainers. So we'll be developing DEIJ education resources that actually a repository of resources that can be shared between programs and made available to GC educators. Also host a tracking system so that GC educators can track their DEIJ related training, and hosting a common reading event. And we also will continue to serve in an advisory capacity to the board of directors of the GCEA and other standing committees as well.
Okay. Hi again, everyone. So my name is Sally Rodriguez. My pronouns are she, her. I am a Hispanic woman with olive skin. I have shoulder length brown curly hair, and I'm wearing glasses and a green shirt. I am here representing the Accreditation Council for Genetic Counseling, or ACGC. The ACGC is focused on advancing quality in genetic counseling education by developing program standards and then evaluating and accrediting graduate level programs in the US and Canada. As mentioned previously, ACGC became an independent organization in 2012. A DEI task force was created in 2020, and their focus was revising language within the existing program standards, as well as suggesting new standards related to DEI. They also recommended the formation of a standing DEIJ committee. This committee was established in late 2022, and I'm one of the current members. Next slide.
Hi, everybody. My name is Rachel Benest. My pronouns are she, her, and I am a middle-aged white woman with shoulder-length wavy hair wearing a poppy red shirt today. And I'm here on behalf of the Canadian Board of Genetic Counseling, or the Conseil Canadien de Conseil Génétique. And we are very similar to the ABGC. We are the Canadian board, with the main mission is to protect the public and ensure quality of care by setting and maintaining certification standards, and to promote the value of the Canadian board certified genetic counselor, with the ultimate vision of setting the national standard for the provision and optimization of genetic counseling health services in Canada. Now, compared to the rest of the organizations, we are probably one of the smallest. We have 380 diplomates. And so in terms of DEIJ committees, we don't have one. It is something that the board considers in all of our work, but we don't have a standing separate committee because we don't really have a ton of committees outside of the board. So most of the work that the CBGC does in terms of DEIJ initiatives come from the board members themselves, and tries to take an overall view of our organization. Next slide, please.
Hi, my name is Nadine Shanawi. I use she, her pronouns. I'm a cis appearing woman with light brown skin and dark hair that's pulled back. I'm wearing a short sleeve, magenta colored sweater at the moment. The Journal of Genetic Counseling is a peer-reviewed journal under the umbrella of the NSGC, and it was founded in 1992 with Deborah Yoon Poo as the editor-in-chief. And Deborah was one of the founding members of NSGC and had been president of the NSGC from 1985 to 1986 before she became the editor-in-chief of the journal. From the time of its establishment, the Journal of Genetic Counseling was considered the first journal dedicated primarily to the psychological, social, and professional aspects of genetic counseling. And the vision and mission statements have gradually been updated throughout the years, yet the journal continues to be the only peer-reviewed journal to focus exclusively on genetic counseling-related research and is considered the premier resource for thought leadership and new knowledge that can be used to guide practice, education, and policy in this area. As J9 Austin transitioned into the position of editor-in-chief at the beginning of 2024, they carved out a new editorial board to include intentional diversity, equity, and inclusion leads within that editorial board. So Kim Zahowski and I currently serve as those co-directors of diversity, equity, and inclusion integration into the journal. And we'll explain those positions a little further in the presentation, but for now, I'll go ahead and move to the next slide. So now that you have heard a bit from each of the thought leaders within NAGCO who are currently working on DEIJ initiatives, we want to go into more explanation of what these initiatives are. And as we were figuring out how to introduce the initiatives, we came up with 6 categories that seem to capture most of our work. Those categories are resources as first, a second being educational content, the third being decreasing barriers to and within the profession, the fourth being support within current membership. The fifth is Journal of Genetic Counseling as a category, and then the sixth is self-assessment. Important to mention, these categories are not exclusive of each other, and often one effort we might have placed into a labeled category for the purpose of this presentation is certainly affecting another area of DEIJ. And in a way, all DEIJ efforts intertwine with one another. Pulling them apart to categorize them, it was mainly done as a way to organize our thoughts on this topic, give snapshots of our work in a digestible manner for everyone listening to the webinar. And additional to how the initiatives overlap in nature, we also want to point out that the way we categorize things may lend to better explanation of work done by certain organizations within NAGCO, and maybe the explanations aren't as good for other organizations, mainly because we don't parallel each other. We have different constituencies, different audiences, different goals, different sizes. But we did our best. We had lots of conversations about how to categorize things. So you might imagine DEIJ's work it's thick, it's complex, it has a history that usually has injustices that led to these types of initiatives. So the way we talk about our work can be teased apart too, all the way down to how we categorize things. Nevertheless, we did do our best to provide both brevity and depth, as well as detail and big picture explanations. So here we go into highlighting some of the DEIJ work we've done.
Next slide, please. Okay, so on this slide, I'm going to highlight the handbooks and guides that have been created by the various organizations, all with a goal of guiding and assisting in inclusive and accessible communications. The ABGC has developed a glossary as of last year so that diplomats could reference definitions for certain concepts or terms in the DEIJ realm. Suggestions for new terms and wording can be sent via contact information on the ABGC website. The document is available on the ABGC website under Diplomat Resources. The ACGC has created a DEIJ language guide. This was completed and published September 2024, so very recently. This document is available on the ACGC website, and an accompanying video is to follow. You see, DEIJ Task Force created the Communication Accessibility Standards Guide with a goal to be used by the organization to assist members in making communications inclusive and accessible. This guide was completed and published early in 2024, and it is available to CAGC members for use in their practice. The NSGC Education Committee has developed a speaker guide that provides recommendations for speakers on how to make presentations and other educational activities effective, inclusive, and accessible for all learners. This and other toolkits and guides are available on the JEDI resources page of nsgc.org. The JOGC has within the editorial board and among peer review submissions, certain elements of inclusive language have been coming up quite often, such as specificity about gender and sex, categorization of racial or ethnic communities, and terms that could be avoided altogether. Kim and Nadine are in the process of putting together a guide for inclusive language where peer reviewers and editors could essentially copy and paste explanations of improved language inclusivity that would be relevant in articles they are reviewing. The hope is that this would help authors, reviewers, and editors to better understand the rationale and utilization of inclusive language. All of the organizations will update their guides regularly and or according to each of their own review processes and standards. Next slide.
All right, so I will be talking about educational content. And so we'll talk a little bit about how different organizations are doing educational content. So the CAGC has had an annual conference for many years now, and it is committed to including DEIJ topics and perspectives in all education opportunities, including the conference. The Scientific Planning Committee ensures that DEIJ topics are a priority. For example, here are some examples of more recent talks. And in 2021, the pre-conference short course was focused entirely on DEIJ topics. As well as the GCEA has an annual retreat. And typically in the past, this was aimed at program leaders. However, with the evolution from the AGCPD to the GCEA, the DEIJ committee hopes that more of the retreat content will be available to more genetic counseling educators. The retreat is organized by the education committee, but the DEIJ committee usually weighs in on topics and suggests speakers. And so some of the DEIJ retreat topics are focused on individuals' self-examination and development. Here are a couple examples on the slide. And others are focused on supporting students, such as examining barriers and solutions to reducing the barriers for prospective and matriculated international students. And others such as on educational practice, rethinking professionalism, and managing student accommodations. And the NSGC conference has been going on for over 40 years. And each year, the NSGC hosts a call for speakers and session proposals. And these are reviewed by the NSGC Program Committee. And beginning in 2022, the NSGC call for speakers asked session submissions to incorporate the JEDI principles and action items throughout the session content. And so recent examples of JEDI topics from the recent conferences are on the slide. And there has been an increase in focus on accessibility at the NSGC annual conference, including virtual options, on-demand CEU eligible sessions, as well as accommodations for in-person attendance, such as mobility or transcription services. And there is also an opportunity for members to apply for annual conference scholarships for those employers who do not fully cover or cover at all the chance to attend, to try to minimize the financial barrier to that. Next slide, please. In terms of other continuing education content, the CAGC does have a webinar series, which is about 5 to 6 webinars annually, and approximately a quarter of these are very specifically centered on DEIJ topics. And these are eligible for CECs, for CBGC recertification, or CEUs for ABGC recertification. And in terms of the CBGC, on September 30th, so a few weeks ago, it was the National Day for Truth and Reconciliation in Canada. And for those of you who don't know, this is a day that honors the children who never returned home and survivors of residential schools, as well as their families and communities. And so the Truth and Reconciliation Committee ran from 2008 to 2015 and provided those directly and indirectly affected by the legacy of residential schools and their policies an opportunity to share their stories and experiences. And with that, the commission released a final report detailing 94 calls to action. And these were calls to action that various levels of government and organizations should look to with an eye towards reconciliation. And action item number 23 was a call to all levels of government to provide cultural competency training for all healthcare providers. Now, the CBGC is not a level of government, but we did take up the call for this action item. And so for our recertification process, there is no charge for up to 10% or 15 continuing education credits towards your recertification cycle for content or classes or courses related to Indigenous rights and issues in Canada. And this is one way that the CBGC is working towards reconciliation. Next slide, please. Other content includes the NSGC webinar series, and they host a year-round webinar series that is eligible for CEUs, and these are often focused on education and other issues impacting the genetic counseling profession. The NSGC Education Committee reviews submissions on a monthly basis, and an example of JEDI-related webinars is Crucial Conversations for Equity, Genetic Counselors Experiencing Inclusive Hiring and Spanish Genetic Counseling webinar, which was presented by the Leadership and Management SIG and the Spanish Development SIG in 2023. To view more NSGC webinars that are eligible for CEUs, this can be found on nsgc.org/webinars. The NSGC Community Conversation Series is designed to foster learning through didactic webinar presentations, followed by a live webinar discussion with the speakers and NSGC members. And so past community conversations have incorporated JEDI related topics and can also be found on the NSGC webinar page. And a couple of the examples of these conversations are listed on this slide. And further, in 2023, the NSGC released a CEU eligible education bundle of JEDI themed lectures from the 41st annual NSGC conference. And this is at a discounted cost. So if you were unable to go to that conference, you can get a discounted rate on the DEI or JEDI themed talks from that conference. Thank you. Next slide.
Thank you, Rachel. Moving into initiatives decreasing barriers to and within the profession. Both ABGC and CBGC administered board exams are pathways for those who graduated from ACGC accredited schools, as well as those who are internationally trained candidates. Remote proctoring is available in both exams. The CBGC exam is also available to candidates from any genetic counselor program around the world and includes a special pathway for those from University of Montreal, whose program is taught in French, providing much needed minority language genetic counselor training in Canada. Next slide, please. ABGC offers a needs-based certification scholarship that provides financial support for a certification exam to individuals who bring diverse perspectives to the field and have the potential to make a positive impact on genetic counseling. CAGC launched an annual bursary in 2021 for individuals who self-identify as First Nation, Métis, and Inuit, with the purpose of providing financial assistance toward applications to Canadian programs. NSGC offers various fellowships, grant awards, and scholarships to promote research, continuing education, and professional development, as well as to increase access to genetic counseling and NSGC programming. Examples include annual conference scholarship, full member new GC membership scholarships, the Lauren Ryan Genetic Counselor Access Memorial Award, and student research scholarships. NSGC members receive updates about various scholarship opportunities throughout the year via email, and a list of fellowships, awards, and grants are listed on the nsgc.org webpage under About Awards/Grants. Next slide, please. The CAGC Board of Directors Student Representative partners with current GC students in Canadian programs to host annual webinars in the fall for prospective genetic counseling students. The prospective student webinar features a Q&A with current students from each Canadian genetic counseling program, providing information about the field of genetic counseling in Canada, the application process, and pathways to certification. New this year is a webinar featuring Canadian students in international genetic counseling programs. NSGC offers mentorship opportunities through NSGC Connect for those who sign up to be a mentor or mentee and are matched based on preferences. Updates to the platform are in the works based on member feedback solicited by the JEDI Stewardship Committee and Membership Committee via member surveys. Next slide, please. CAGC Ask a GC program launched in 2023, where certified genetic counselors have answered commonly asked questions on the website. CAGC hopes that this program can increase accessibility to the GC profession in Canada. NSGC partners with high schools, colleges, and organizations that support underrepresented students in healthcare to help increase awareness of genetic counseling as a potential career path in STEM for students in various stages of their educational and career journeys. Annual outreach events at high schools and colleges local to the NSGC annual conference is one example. Another one includes the membership committee, who attends career fairs and conferences each year in partnership with organizations supporting underrepresented students in healthcare and STEM. Also, NSGC offers recruitment resources for members to utilize when conducting student outreach. This is a list of actions taken by the organizations within NAGCO member orgs and not representative of the hard work in organizations such as MGPN, AGJ, the Puja Way Scholarship Fund, the Warren Alpert Foundation, and many, many more who have really taken on a lot of work to reduce barriers to the profession and build webs of networks between genetic counselors, genetic counseling students, and prospective genetic counselors. Next slide, please.
Great. With that, I'll take us into some specific resources that NSGC offers to support its current membership. And kind of as Guy was highlighting as part of the last slide, this is really a quick breakdown of some of the resources we want to highlight for NSGC. This list is not all encompassing, and it doesn't reflect the variety of ways our various organizations do support members around JEDI efforts, but these are some specifically published resources through NSGC. And all of this work, I also want to specifically highlight that all of this work I'll be highlighting is thanks in part for this first bullet. Let me clarify. For the first bullet is really highlighting work that's been done by volunteers within NSGC, either who have developed these resources as part of their own individual projects, or from committees, subcommittees, working groups, and special interest groups. So want to especially thank those who have spent their time volunteering within NSGC, especially those who may have helped contribute to these specific resources. And just a few examples of some of the resources that can be found on the JEDI resources page of NSGC include the Cancer SIG Cancer Curriculum Toolkit, which is really aimed at cancer course coordinators and instructors. The Prenatal SIG produced a Reproductive Justice Toolkit that's really awesome, so take a look at that if you haven't seen it already. And there's also a resource for GC managers on creating an inclusive workspace. And that's just kind of like a smattering of the many resources that are available on that resources page. Separately, the NSGC link is kind of a newsletter that goes out and includes a JEDI spotlight section each month. So if you are an NSGC member and you're not receiving that newsletter, go ahead and go into your member profile and update your settings, because it is a nice way to get a sense for what's happening across NSGC, including specifically JEDI efforts. And then Perspectives is a great publication that offers relevant and cutting edge information related to clinical practice, research, education, career and workforce, as well as JEDI. So really thankful to have that publication as well. And with that, I'll pass it off to Nadine.
So one of the first things that Kim and I addressed as the DEI integration co-directors of the journal this year was updating the diversity, equity, and inclusion statement, which did exist, prior to us coming on. So we updated it. And I included just an excerpt of that statement here because I do think it highlights well why we feel like DEI integration is important within the JOGC. So especially given the history of equity, oppression, and eugenics in genetics research and clinical practice, the JOGC is committed to integrating principles of DEI throughout all aspects of the journal's operations. And I think you'll find on the next slide the way I think of this and Kim as well. Really, we feel like what gets published through the JOGC can either potentially perpetuate the status quo, or it can exemplify movement toward justice, healing, reparations, and betterment of diversity and inclusion in our field. Next slide, please. The image on this slide is mainly a way to show that we have a top-down approach to the DEI work we do. And starting at the top, work we've done at the editorial board level as of recently has included the instatement of the DEI integration leads embedded within the editorial board. Also, J9 Austin has worked intentionally to increase international representation within the editorial board. Third, within our board meetings themselves, we always have a very tight agenda, but DEI always gets onto the agenda, and often it's the largest allotment of time goes to a DEI topic. We've really had a lot of interesting conversations about ethics and standards that the journal exemplifies, and that has led to our recent decision to have separate DEI meetings with board members, and those will be a way to kind of hash out certain topics and maybe create some standards around particular DEI topics. Lastly, at the editorial board level, Kim and I are available for DEI consults where another editorial board member might want some guidance on how to comment on a paper or might want another perspective to just focus on a DEI lens as in the review of a manuscript. So they might web us in for that. At the next two levels of the journal's operational workings, they're largely kind of joint beneficiaries, the peer reviewers and authors for DEI work that we've done. The JOGC now has office hours, and those are open to anyone upon request. These office hours are meant to be a way that people can ask about a whole host of different topics, and those might include DEI topics. For example, we recently had a conversation with several prospective authors who wanted to include some acknowledgement of their host institution as well as some acknowledgement of their own beliefs. And we were just talking about how to make their goals met, whether that be within the journal or not. And those are the types of conversations that office hours is really meant for, to talk, figure things out in a nuanced way. Secondly, at this level of these peer reviewers and authors, as mentioned earlier in the presentation, Kim and I are working on a guidebook or a guiding reference for inclusive language around common concepts or terms that are coming up through in multiple manuscript submissions. Another thing we're doing is gathering information about accessibility, diagrams and graphics so that the journal can provide better guidance on how authors might improve the inclusivity and accessibility of their diagrams and graphics. And so that peer reviewers can also have a reference on how they might check for accessibility and inclusivity within graphics, specifically in infographics. Lastly, earlier this year, we did a call out for volunteers who have fluency in a language other than English to assist with a particular small set of submissions that get to the journal. And we think the paper is really valuable. It's well executed, novel work, but the English itself is not quite ready for publication, and maybe not even ready for peer reviewers to read through it. And this group of volunteers has been awesome because they are this asset that we can tap into for really very few papers, but a few. And these then can kind of go to this pool of volunteers. Someone might specifically be asked to approach that author team, or we might ask, is someone available to work with this author team? Usually it's an author team that's international and doesn't necessarily have access to English language consultants. And then at the bottom of this diagram, I put like the readers of the journal. I mean, the largest group of interactors with the journal is our readership. And this year, as well as previous years, there have been themed issues that have been put together on a topic specific to DEIJ. So in June for Pride Month, we had an LGBTQIA+ virtual issue with free access to all of the articles that were put together into that issue. And those were all articles that were previously published by the journal and centered on LGBTQIA+ topics in genetic counseling. A similar issue was put together for Black History Month previously, and we hope to continue doing these types of conglomerated special issues. Also new this year, we have a JOGC podcast, and that is called DNA Dialogues. It's freely available. Each episode dives deeper into one or more recent publications, and the podcast is really another way to engage in happenings of genetic counseling research that's not necessarily reading an academic journal or in combination with reading an academic journal or article. It's a way to engage in reciprocity where communities who might have contributed to what we're learning in genetic counseling, and they can hear about it without being behind a paywall and the academic work. Speaking of paywalls, we are thinking about how we might issue open access or free access to certain articles, and what that might look like, or how we might set standards for that. Really, so that covers that diagram, and I'll pass it off to the next slide.
Hi everyone, this is Enrique again. So I'll be talking a little bit in more detail about some of the organizations under NAGCO are using processes that have been developed to measure the progress of DEIJ efforts. And again, this is a non-exhaustive, but just some examples. So from ABGC, we had that independent assessment from the group from nonprofit HR back in 2021. And they reviewed the exam processes and all the active exam items. They gave recommendations based off of this, including getting demographic data, forming a committee for DEIJ, and additionally training for DEIJ items was done by the CEC, the Certification Exam Committee, which started in 2020, so before nonprofit HR. And there's still current efforts being done to advance that progress. We began collecting this data. We created this glossary, and then we created the DEIJ committee in 2022, essentially to start coming up with different avenues where ABGC can ameliorate the access to minorities in the ABGC and taking the certification exam. And CAGC There was a DEIJ task force that was created in 2022 with the purpose to create accessibility and communication standards, perform environmental scan of current DEIJ initiatives within the CAGC, and make recommendations regarding appropriateness of establishing a standing DEIJ committee. The DEIJ task force recommended a standing DEIJ committee, and this was newly formed in 2024. The DEIJ committee will appoint a DEIJ director who will have the position on the board of directors beginning in 2025. And one of the mandates of this committee will be to establish methods to monitor progress within the organization. Next slide, please. For NSGC, NSGC partnered with an external consultant to conduct a JEDI organization assessment in 2020 and 2024. The findings and recommendations from each assessment are available on the JEDI resources page of nsgc.org via executive summaries and webinar recordings. NSGC also created a dashboard to outline progress and action related to the JEDI action plan that was developed after the 2020 assessment. The newly updated dashboard is updated quarterly and details NSGC's progress in achieving organizational JEDI goals across 6 operational impact areas. And NSGC strategic planning and committee charges incorporate JEDI and NSGC host quarterly committee meetings to evaluate their progress. And lastly, the PSS is administered to genetic counselors who are either members of NSGC, members of CAGC, and or diplomates of ABGC. The PSS provides a detailed profile of the current genetic counseling workforce, primarily in the US and Canada, and identifies new and emerging trends in the profession. The JEDI chapter examines several facets of diversity and inclusion within the genetic counseling profession. Thanks. Next slide.
All right, so thank you so much to our panelists, and we're going to move it into Q&A now. Would you mind showing the next slide as well? We also want to recognize that today's joint presentation neither represents the full scope of DEIJ work going on within the genetic counseling communities, nor the full scope of what needs to be done to continue moving the needle towards a more diverse, just and inclusive profession. So we hope our introductory approach fosters some ideas or questions from the audience for our speaker panel. And you're welcome to use the Q&A feature, and I will read out the questions. On the last slide here, we have contact information for each NAGCO organization. So moving into a question that was submitted in the Q&A. So how are the organizations making sure that the people, or maybe at least one person, reviewing all of this, such as journals, grants, applications, etc., are part of the community that is being targeted? I ask this because I've seen some research studies targeting Spanish-speaking individuals without anyone that speaks Spanish in the project, and found gaps in the research that have concerned me. So I think this question might be great for the organizations that have scholarships within their organizations. So ABGC or NSGC, would either of you like to take that question?
I'm happy to start, and Madeline, who's on the call, feel free to fill in. It's a great question. Thank you for asking it, Valentina, because I think we've all seen a variety of ways where backgrounds and expertise of any kind may not match kind of the work that's being done, and it can be a real challenge. I think from my perspective on the JEDI Stewardship Committee, there's not like a a database necessarily of NSGC members and their various identities that they hold. There's not always a specific SIG or committee or membership group that is a clear candidate to reach out to for specific topics. But that being said, we do try, for our committee's work, we do try and identify those groups where we can to collaborate closely. For example, the Disability GC group, we're hoping to collaborate with them on a whole survey. But for scholarship applications specifically, I'm not sure how folks on those review groups make sure that there's representation at all levels. I think that is the challenge, especially in a profession that may be sparse for reflecting all types of backgrounds and different forms of identity. So we do the best we can. It's a lot of making sure we're in connection, right, with other groups so that we know the resources that are available to us, and then trying to network through other members to find those groups where we can. That's what I would say. But curious to hear what others on the panel would say.
Yeah, so for ABGC, at least with the newly developed scholarship that will be starting in this upcoming certification exam, it's hard to have, again, every single group of representation reviewing every single application. We try to have a vast diversity of individuals on the committee itself in the first place. That's when we're choosing individuals to get a bunch of different perspectives, whether it be ethnicity, whether it be gender identity, many different factors. And hopefully if we get a pretty diverse and many different perspectives, we can at least view it from that perspective and an application process. I can't speak to if we get a specific application from someone who's of a specific minority and that minority isn't on the scholarship. At least, sorry, if that minority isn't on the application review process, how that'll impact, but at least if we have our various perspectives coming together, hopefully it'll reduce the bias that we have in reviewing that application.
Did you want to add?
Yeah, I did. And I wanted to also just echo what you're saying, Valentina, of seeing research on a community and not seeing that community represented in the team that worked on it, and that is not ideal necessarily. And at least if it's coming through the Journal of Genetic Counseling with hopes of getting published, we are really trying to get author teams to hopefully disclose at least some information, whether that's collective or individual, about how the research team is related to the topic and community at hand. And if they aren't, what did they do to overcome that? Or if they didn't do that, to acknowledge that bias. But I hear you, and I think this is something that we really need to make sure that especially our published research is acknowledging why gaps might exist, and that'll help to ameliorate them. But ideally, yeah, we want representation or acknowledgement that there isn't representation.
Thanks so much. Another question is, with several states having laws targeting DEIJ, specifically the phrasing or wording within education, have any of the committees had thoughts about changing your committee name as to not be a target in the future? I say this because we are considering coming across the Access and Engagement Committee versus the DEIJ Committee to mitigate this fear.
So I think I'd like to add in something. My name's Heather Rich from ABGC. I can say specifically from an ABGC standpoint and specifically with the needs-based scholarship, we did consult our legal counsel because we know that these are issues kind of coming up and what you can actually review versus what actually can be given back to us and the information and how we store that information. So I would say that we don't have any plans at this time to change our name, but we did have a lot of discussion with our legal counsel on what the name of the scholarship is so that it doesn't flag any potential legal action. So we are very conscious of that, and it's something on a yearly basis our legal counsel continues to give us feedback on from a certification perspective of what is not going to get us in trouble when we want to, try to help and provide access to the GC community and our new candidates that are coming in. So that's what we're doing so far.
Thank you, Heather. Anybody else want to weigh in and member orgs? I know with GCEA, we are very aware because some of our programs have constituencies who are bound by some of these restrictions. At this time, we had not considered renaming the organization, but that's a very thoughtful question.
Sorry, Guy, just sorry to interrupt. I just
Yeah.
want to fill in from the ACGC end. So, of course, ACGC accredits genetic counseling programs, and there are genetic counseling programs across, all the states, presumably. And of course, these DEIJ laws and regulations are coming into play and can affect how a program can apply the ACGC standards within their curriculum. So I know that the PRC committee within ACGC is, obviously aware of these various legal issues, and there are ways for programs to essentially apply for exceptions and how exactly things are worded in their curriculum, et cetera, so that we can remain compliant from a legal perspective, or programs can remain compliant from a legal perspective, but obviously so that we're not, negatively affecting student education. So it is something that is on ACGC's radar. If you have more specific questions about how these, about this specific topic in ACGC, please feel free to use the contact information on the slide to reach out to the organization and get some more details.
Thank you. So another question is, are there any initiatives within these associations to support individuals within our community who identify as neurodivergent at this time? If not, are there any plans? There's some answers being typed right now. So it looks like at least two members of the panel are typing up some answers. But if anybody would like to also answer live.
I'll answer live while the NSGC types. The CBGC exam in the context of neurodivergency is open to exam accommodations. So all of our exams are remotely proctored. So you are at home, you are in your space, which typically you would set up to in an ideal way that works for you. And if extra accommodations such as time are required, the exam writer can request that. And so those are the accommodations that we have made with the CBGC exam.
I can probably echo some of what Rachel has shared too. So the CGC exam is offered in person and remote proctored as well. We offer a full array of accommodations that are required for candidates. And after transferring to our new test vendor, we've seen a very smooth process in that. So our candidates are receiving the accommodations that they require, and we're receiving positive comments on that. So whatever a candidate may need that is within the realm of not giving them an advantage over another candidate, those accommodations are processed and approved through ABGC.
The next question is for CAGC, Diane. You discussed an increase in DEIJ content at conferences. What is being done to increase accessibility to members who are unable to access the CAGC AEC in person? Scholarships can be helpful in the financial aspects, but not with other factors that may prevent folks from traveling. A virtual registration option is highly desired.
Yeah, this is certainly something that CAGC is considering. I think we certainly recognize the value of being in person and having that collaborative experience, but we also recognize that there are barriers for many people to attend in person. We are considering options that would allow us to provide some content to members, such as something similar to what NSGC is doing, perhaps bundles of specific talks that we could make accessible to individuals after the conference. I think at this time, you know, while perhaps a hybrid conference would be desirable, I think it's perhaps cost prohibitive. I think it's something that we're continuing to assess, but it's very challenging from a cost perspective to have a fully hybrid conference. Thank you for your comments. I mean, I think we're taking feedback into consideration and certainly want to reduce barriers as much as possible.
Thanks, Diane. Another question came in for any one of us, and have the committees given thought or taken preparatory action in regards to the impact of the upcoming election in terms of the risk of reversal of DEIJ political policies? I mean, speaking for just GCEA, we haven't taken any preparatory steps per se, but I'm speaking only from the DEIJ committee. I'm not, I can always bounce this question to our board of directors. But again, you know, because we have programs in many different states for where there are continuing restrictions on DEIJ, we're very aware of the struggles that programs are facing. I think the other piece of this is that with ACGC, our accreditation standards in order to stay credited with ACGC means that we need to ensure that all of our genetic counseling educators and instructors and program leaders are doing continuing education in order around DEIJ specifically in order to meet the standards. So this is a quandary that we're very much aware of. Anyone else want to jump in as well on this question? Right. I'll just amplify a couple of things in the chat, which is that there's interest for a SIG for neurodivergent GCs. That's a wonderful idea. Also, the Spanish SIG is starting a research committee to help individuals find Spanish-speaking experts in the specialty necessary and to help people with research projects that will target Spanish-speaking people. And then also SIG applications from NSGC closed in July, but please make sure to check this web page and future NSGC communications to learn when the next application cycle is live. And there's a hyperlink to nsgc.org/SIG. Thank you so much for engaging with us today and asking your questions. We appreciate your time.